So what is sedation dentistry? Sedation dentistry is the use of medications to help ease people's fear and anxiety during dental treatment. It becomes especially useful when people need a large amount of work done, wisdom teeth surgery, or even for people who have a severe gag reflex. At Sherwood Dental, we offer two types of sedation. The first type of sedation we offer is nitrous oxide or laughing gas sedation, and the second type of sedation we offer is oral sedation. Nitrous sedation, we often use it a lot in kids, and oral sedation more so in adults. Both are quite effective, and most people are good candidates for sedation dentistry, but they first need to be assessed and have a consult with a dentist just to determine that they're suitable. Nitrous oxide is a colorless, odorless gas that has been used for a long time in the medical and dental setting as a means of a sedation. People remain conscious when we use this type of sedation, and we mostly use it in kids, but there are some instances where adults like to use it too. One of the biggest advantages, I would say, of nitrous sedation is how quickly the onset is, but more importantly to me, it's just how quickly it dissipates and leaves the body. So oral sedation involves the use of oral medications by mouth that are often taken just prior to your dental procedure to ease anxiety or dental phobias. Oral sedation, we commonly use it in adults at Sherwood Dental, and people, they usually don't remember their appointment, and so it's a pretty relaxed state that they're in during the appointment. Oral sedation, it is often referred to as conscious sedation just because people are awake for the entirety of the sedated procedure. A tooth can need a filling for a variety of reasons. Number one, it could have a cavity. Number two, it could have fractured or broken. And number three, sometimes we do fillings as build-up procedures for cosmetic reasons. In terms of pain, why a tooth may need a filling and doesn't hurt and having a cavity, more often than not, a tooth will not hurt until a cavity is very, very large and getting very big. It is actually incredibly rare for a small to medium-sized cavity to hurt a patient, unfortunately, this is the best time to fix the tooth is when it's small to medium size. So people often don't know when their tooth needs a filling due to a small or medium sized cavity. If a tooth is starting to hurt, unfortunately, the tooth is usually entering the realm of needing a root canal at that point, or even worse yet, needing an extraction. So we always recommend coming in regularly so we can find cavities and things like that before they do start to cause pain. So a dental sealant is a resin that we apply to the grooves and pits of the back teeth, usually molars and premolars, and it's typically done in kids or teenagers. The whole point of it is to prevent cavities from forming in really deep pits and really deep grooves that people have that are otherwise really difficult to clean with a toothbrush. After about 2 to 3 years, the sealants usually fall out, and by that time the grooves have hopefully shallowed and the pits have shallowed to the point where they're easier to keep clean and the patient no longer needs sealants anymore.